10 Essential Facts About Weight Loss Medication. The Food and Drug Administration (FDA) has affirmed 4 medications since 2012 that are intended to enable corpulent grown-ups to shed a portion of their abundance weight, yet customers' genuine information about the medications fluctuates extraordinarily. In spite of the fact that weight reduction results are humble, these medications, Belvic, lorcaserin hydrochloride, Contrave, naltrexone hydrochloride and bupropion hydrochloride, Qsymia, phentermine and topiramate, and Saxenda, liraglutide, can give a few patients an edge with regards to getting more fit, yet they accompany dangers, says Kim Goodzune, MD, MPH, right-hand educator of medication and a heftiness master at Johns Hopkins Medicine in Baltimore. So in spite of the medication's adequacy in kicking off weight reduction, a few doctors are as yet hesitant to suggest them, given the vulnerabilities about their dangers and symptoms. Before you see your primary care physician, here are 10 significant things you have to think about medicine weight reduction drug. 1. Weight reduction meds are approved for people with significant weight problems. Weight reduction drugs aren't intended for the individuals who need to shed a couple of pounds before the class gathering or a seashore getaway. As indicated by the FDA, you have to have a critical weight issue to be endorsed to weight reduction tranquilize, for example, a weight list of more than 30, or weight that makes it hard for you to control other medical problems, similar to hypertension, elevated cholesterol, or type 2 diabetes. 2. Huge numbers of these drugs are off limits to pregnant women or those trying to get pregnant. Whenever taken during pregnancy, Belvic, Contrave, Qsymia, and Saxenda can make hurt a hatchling. Ladies of childbearing age should utilize contraception reliably while consuming these medications, and ought to be tried before they begin taking any of them to ensure they aren't pregnant. 3. The results may be modest, however the health benefits can be significant. By and large, hope to lose 6.7 to 8.9% of their weight, or around 7 to 9 pounds for each 100. Those taking Saxenda had a normal loss of 4 to 5% of complete body weight in preliminaries. While that may not appear a lot, losing 5% of your body weight is a great momentary objective. Specialists at the Centers for Disease Control and Prevention (CDC) exhort that losing even 5 or 10% of your body weight can create positive medical advantages, including lower pulse, better glucose control, and improved blood cholesterol. As indicated by the Obesity Action Coalition, a 5 to 10% misfortune can bring about a 5-point increment in HDL, or great cholesterol, and a 40 mg decline in triglycerides, hurtful fat-like particles in the blood. By and large, converse with your primary care physician about a dietary arrangement or calorie objective that will assist you with arriving at a solid weight. 4. A companion diet and exercise plan is needed to meet long-term goals. Weight reduction drugs are to be utilized as an enhancement, not a substitute, for your weight reduction endeavors, says Nikhil V. Durandhar, Ph.D., educator and seat of the branch of Wholesome Sciences at Texas Tech University in Lubbock. You despite everything need to practice and eat a decreased calorie diet if you will likely lose huge weight. For additional help and calorie-controlled dinner thoughts, attempt Everyday Health's free meal planner, which can be customized to meet your weight reduction objectives. 5. These drugs come with side effects. That is valid for each medication for any malady, Dr. Durandhar says. Qsymia can build pulse in certain individuals, as indicated by the FDA, and Contrave can cause seizures and may expand the danger of self-destructive intuition in certain patients. What's more, reactions can make it difficult to stay with your endorsed course, Dr. Goodzune notes. 6. Your doctor may need to change your dose over time. Not every person reacts to a similar medication in a similar manner, regardless of whether it's weight reduction drugs or different medications, Durandhar says. Like any new prescription, your doctor may put you on a littler portion to perceive how well the medicine is endured. Show restraint, doctors have few weight reduction medications to browse, and it can set aside effort for them to think of the correct mix for you, he says. Utilize a calorie tallying application or keep a diary with data about how you're feeling, changes in weight, and what you've been eating to impart to your primary care physician for ideal outcomes. 7. You may have to be on the drugs long term. Taking a prescription for a quarter of a year as a rule doesn't work, and you recover the weight when you stop, Goodzune says. Like any weight reduction exertion, you have to focus on a drawn-out arrangement to get thinner and keep it off. 8. All weight loss drugs aren't created the same, some block fats, while others curb appetite. The ones that square fat in the food you eat can have terrible gastrointestinal reactions. Orlistat, an oral medicine that squares fat ingestion, is sold over the counter as Ali, and as the solution Xenical. Other oral prescription, as Belvic, Contrave, and Qsymia, go about as craving suppressants. Saxenda is an injectable medicine that impersonates a hormone that tells your cerebrum when you're full. Converse with your primary care physician about a medicine and an arrangement that works with your way of life. 9. Just about 1/3 of insurance companies cover weight loss drugs. Also, another third have limitations on what they will favor and when, as indicated by Kaiser Health News. Visit your safety net provider's site to survey a rundown of remedies that your arrangement covers. In the event that your arrangement doesn't cover these medications, you may fit the bill for a markdown to help settle the expense of medicine. The medications can cost $200 or $300 per month using cash on hand, Goodzune says, so it merits getting your work done. 10. A few doctors are reluctant to address weight loss drugs, and you may need to make a case for a prescription. In 2013, the American Medical Association perceived corpulence as a malady, yet not all specialists treat it accordingly. A few specialists are hesitant to endorse weight reduction medications, and patients then again might be hesitant to take them because of a paranoid fear of reactions, Durandhar says. Specialists may likewise be hesitant in light of the fact that a few medications have been pulled from the market throughout the years because of outrageous reactions and dangers, Goodzune says.